started. Sorry, the doctor's in the house finally, which is great. He's busy. He fit us in between patients, so we're grateful for that. So thank you. So welcome to our October Well session. Today we have Dr. Noah Goslin from Main Street Wellness with us. Some of you may recognize him if you were at the Spring Wellness Fair. He was at both of them. Dr. Noah is joining us today to speak about the importance of regular chiropractic care and how proper alignment can bring positive benefits to our immune system. A perfect topic as the weather's changing and flu season is fast approaching. Dr. Noah believes that our health is our most important, most valuable possession and something that needs to be earned. His goal is to help as many people as possible in the greater Nashua area to live a pain-free life without the use of drugs or surgery so that they can live their most optimal life possible. Just a couple of housekeeping things for those that haven't attended a session before. They are being recorded so that staff who don't have access to come to these during the day will have access to the materials when they're able. So if you have a question, if you could put your hand up and I'll run the microphone over. That way the people that are listening at a later time can hear your question and get the answer that goes with that when Dr. Noah gives the answer. So without further ado, I'm going to turn it over to Dr.
Thank you very much, Christy.
Noah.
So my name, can everyone hear me all right? Is this too much? I was told to use the microphone because it makes it a little easier for the recording. So my name is Dr. Noah Goslin. Thank you for the introduction, Christine. I'm born and raised in Nashua, New Hampshire. Went to Nashua High School North. A little bit about myself. I went to Plymouth State University where I studied exercise science with a big focus on human anatomy and physiology. I went down to chiropractic school in South Carolina at Sherman College of Chiropractic, where I graduated cum laude, and now I've been working at Main Street Wellness and Chiropractic for the last 3 years. So this talk is going to be geared around defeating the desk. Who here works at a desk? Everyone. Who's here has had neck pain or back pain before? Almost everyone. About 80% of Americans have deal with back pain or neck pain at one point in their life. Pain is just a signal that our body is not working the way it's supposed to. It's kind of like a check engine light coming on. When you see your check engine light on your dashboard, what do you do with it? You take it in for a service, right? You don't just take black tape and put it over the check engine light and ignore it. So we're going to be talking about health, productivity for the office professionals. It's a little bit about myself. So today we're going to be discussing something critical to your daily life, the hidden cost of sitting. We'll cover the science of how your work environment impacts your body and how the Main Street Wellness and Chiropractic protocol can help keep you healthy and productive. So a little statistic, the average office worker sits for over 10 hours a day. The posture puts immense stress on your spine, your neck, your low back, your shoulders. Another little statistic is that sedentary behavior is linked to an increase in 2.7 times more likely to develop a cardiovascular disease because we're not moving the way we're supposed to. So at some point today, I'm going to show you guys some stretches, give you guys some advice on how often you should get up, move around, do any little exercises here and there. So think about your spine as the protector of your nervous system. The nervous system is our power line. Think about our spine as a circuit breaker, right? If a circuit is blown, everything that comes off of that circuit isn't working right. Now our spine protects our nervous system, which is controls every single cell, tissue, organ, system inside of our body. So your spine is the protector, and if your posture in your spine from sitting long periods at the office, hunched over a computer, gets stressed over time, bones start moving out of alignment. We have these little bones in our spine called vertebrae. When the vertebrae move out of position, they start putting pressure on the nerves. And when there's pressure on the nerves, now we don't have proper communication between our brain and our body. Research shows all it takes is about the weight of a dime to reduce that conduction of the nerve by up to 40%. Who here is married? Have you ever gotten into an argument with your loved one because there was just a miscommunication? Almost everyone, right? If you've been married before. Think about that with your body and your brain. When something's not working right in the spine, it interferes with that communication network, which is our nervous system. So now if we have that misalignment or a subluxation in the spine, it puts that pressure on that nerve. Now every third signal that's going from these organs, tissues, glands, whatever, isn't getting proper information to the brain. And then the brain can't tell the body what to do if it's not proper communication. If you were to tell your husband, wife, significant other, hey, I want chicken parm for dinner, and she heard on the phone, oh, you want chicken Alfredo? Then you go home and you're like, what the heck is this? I wanted Parmesan, not Alfredo. Then it turns into a little argument, and that keeps going on and on and on. And then there's a huge disconnect, and then you're like, you're not the person I used to know. And then so now we want to make sure that So the cost of desk work is pretty crazy. It's nice that we have the ability to work at a desk and we don't have to go in fields anymore or pick apples or anything like that. But a little statistic, low back pain is the single leading cause of disability worldwide. In the US, musculoskeletal disorders lead to nearly 364 million lost workdays. That's more than any other major health concern. That impacts your productivity of your team, your job, and your life. That's not only including what's going into your pocket. If you're not working, you're not making money, and if you're not making money, then that adds a whole extra stress onto your body, which then affects your immune system. So this constant forward head posture and slumping causes that misalignment in the spine, which we call a vertebral subluxation, and that puts pressure on those nerves. This acts like a dimmer switch. If the dimmer switch is all the way up, we have really good lights. If the dimmer switch is all the way down, it's not working the way we want it to. So we can't have proper communication. So what we focus on with Main Street Wellness and Chiropractic is not just putting tape over the check engine light, but it's about correcting what's causing the pain in the first place. So the chiropractic adjustment fixes the subluxation and turns that circuit breaker back on so that we have proper communication between our brain and our body. This pressure, when we have a neck tension, low back tension, shoulder pain, elbow pain, wrist pain, it's from chronic wear and tear on our body. Over time, that starts causing stress, and then that's when we start feeling the pain. Pain is one of the last symptoms to show up when a joint is dysfunctional, and one of the first symptoms to go away once we start correcting that function in the joint. So chiropractic care helps optimize your immune system by calming the nervous system. When your posture is poor, your spine is stressed, it adds more stress onto your nervous system, puts you into a fight or flight situation. Our nervous system is supposed to get into a sympathetic nervous system, which is the fight or flight. When we're stressed out, it's a very primitive reflex that we have, just like when we were running away from saber-toothed tigers back in the day. Everything gets all stressed. Our blood goes to our limbs so that we can run away. We're not worried about digesting food or fighting off a disease or virus or a bacteria or anything like that. So when that stress level goes up, cortisol increases. And when cortisol levels increase, it dampens the effect of the way that the immune system is functioning. So just because our head's forward, it can literally cause you to not be functioning the best way that you can, and now your body's not doing what it's supposed to do. Our body is actually a very smart being. It knows how to fight disease, it knows how to fight viruses, it knows how to take care of itself. But if it doesn't have the communication to do that, then the brain can't tell the body what to do if there's interference in that network. So when a subluxation is corrected, we reduce that stress on the nervous system and allowing your immune system to work the best way it can, which means fewer sick days and more productivity in our life. So when pain becomes pathology, chronic strain on the spine eventually turns into degenerative disc disease. Who here has heard of degenerative disc disease? Bulging disc, herniated disc. Same thing as that. Degenerative disc disease means there's a lot of compressional force going onto the spine, and then the spine's not able to adapt to that, so now it just presses. We have these little cushions in between each vertebrae in our spine called discs. Think about the disc as a jelly donut. Who here likes jelly donuts, right? So good for you. Not really. They're good tasting, though. So when you have enough pressure on that disc, that jelly material starts oozing out, and where the jelly material goes out, it starts pressing onto the nerve. And now you do that long enough, then you get that sciatica, numbness and tingling in your hands, weakness, maybe some loss of bladder control, stiff when you wake up in the morning, stiff when you get out of a chair, can't turn your head one way or another. So we don't want that. So now when we have this point, when we have chronic stress on our spine or on our joints, we're dealing with a circulatory issue because now not enough blood's getting there. When we have chronic stress, it builds up scar tissue. Scar tissue, imagine that like Elmer's glue. They just took it and they threw it onto your tissue. It hardens, and now you're not able to move the way that you're supposed to. That inhibits the amount of blood that is able to get into that area. Blood is where we get all of our healing from. Now we also are dealing with an inflammatory issue. When something's not working right, it sends off pain molecules that tell the brain, hey, this is painful. So we want to work on decreasing that inflammation. And then we're dealing with a degeneration of tissue. Longer you stress a tissue, the faster it's going to degenerate. You take that stress off, it's able to heal. So our multimodal approach uses advanced technology to reverse these changes and get you optimized so that you are able to function, work, heal the best way that you can. So one of the things that we do when it comes to bulging, herniated, degenerative disc disease is it's called non-surgical spinal decompression. It's a non-invasive, non-surgical approach to decompress the spine. A lot of surgeries out there, there's nothing wrong with surgery, but surgery should be a last case scenario. There's a lot of different options that you can do before it gets to that point. When we have pressure on the disc and that disc material starts oozing out, we use the non-surgical spinal decompression, which is a revolutionary machine that starts pulling the spine apart, creating a little stretch in there, and it creates a vacuum effect, pulling the jelly material back into the disc and taking the pressure off of the nerves. When we take pressure off the disc, we take stress off of it, and now that disc is allowed to heal itself and rehydrate. One of the other things we do in the office is it's called Class 4 laser therapy. Big fancy word for what this does is it's called photobiomodulation, which means light healing. So this machine emits a near infrared light, targets the body all the way down to the cellular level to the mitochondria. Fourth grade science, mitochondria, powerhouse of the cell, right? Produces all the ATP. If our cells aren't working the way they're supposed to, then we don't have enough cellular energy to allow the body to heal the way it's supposed to. So photobiomodulation helps decrease the inflammation, increase the cell production energy, and then helps the body heal at a faster rate and kind of kickstarts the healing process. Now we use extracorporeal shockwave therapy for more of a chronic issue. We get really good results with this for tendinitis, rotator cuff issues, carpal tunnel syndrome. When we have a lot of repetitive motions, when we're working at the desk, especially on the keyboard, our wrists get in a flex position, and that's essentially what carpal tunnel is there's scar tissue that builds up around that nerve that supplies into the hand, right at the wrist, and then that scar tissue is putting pressure on the nerves, then we get the tingling in the fingers, or just my wrist isn't working the way it's supposed to. So what the shockwave does is it sends little sound waves into the tissue and dissolves the scar tissue so the body can just absorb it and get rid of it. It also creates little micro traumas inside the tissue, which causes a surplus of blood to go in there. I like to think about shockwave based on what the literature says is like a Zamboni. Who's here that watches hockey? Bruins are starting this year, right? You see the Zamboni come in after each period, it shaves, gets rid of all that shaved ice, lays down some new water on there so it's nice and clean. Shockwave's kind of doing the same thing for pain. When we have chronic pain in there, it's called mucoid substances. These substances tell the brain, I'm in pain, don't move this because it hurts this way, don't move it this way because it hurts. So the shockwave goes in, removes those pain molecules, helps bring in more blood so the body can just heal faster and function the way it's supposed to. So what we're gonna do, we're gonna do a little break here. Any questions about anything we went over so far? So we're gonna go over some stretches. I put this in because, you know, it's the office, right? Dwight does all the karate stuff. So research shows we shouldn't be sitting more than 45 minutes at a time. If you catch yourself sitting 45 minutes, get up, move around, set a timer every 45 minutes so you can move. We're gonna go over some stretches that you can just do at your desk. You don't have to go on a jog outside, especially now that it's getting colder. So these are to target postural muscles, and they're just gonna be 5 simple exercises that we can do. So the first one, what we're gonna do is we're gonna sit nice and tall. Everyone uncross your legs for me, please. We're gonna just gently bring our head back, and then bring your left ear towards your left shoulder, and very gently, with your left hand, grab onto the right side of your head, and just slowly pull it over towards your shoulder. And we're not doing very hard, just enough that you feel a pull. When you stretch, you wanna make sure you only go until you feel the stretch, no more, because then you can run the risk of injuring the tissue in there. And we're gonna hold this for about 30 seconds. And make sure you're breathing through this, don't hold your breath. And we'll just do 15 today, if that's all right. But when you do these on your own, 30. And then we're gonna do the same thing on the other. But the key to this, make sure your chin's up a little bit. Chin's up just a little bit. Right ear towards the right shoulder, gently pull over towards the other side. Okay, good. Any issues with any of those from anyone? Okay, good. Okay, the next one, if you can find a doorway to do this in, you're going to get a better stretch, but you don't necessarily need the doorway. We're going to work on the pecs. What the pecs are these big muscles that everyone has on the front part of our chests. They do this motion, but when we're working at the desk, our shoulders start rounding forward like this, then our head starts coming forward, and then now it puts extra stress on our spine. Biophysics tells us that for every half inch that our head's in front of our shoulders, it increases the weight of the head by up to 10 pounds. Our head's only supposed to weigh about 10 to 15 pounds, depending on the individual. But if our head's an inch in front of our shoulders, now we got this 25-pound bowling ball on top of our shoulders, adding so much extra stress to our low back and the rest of the spine. So we're going to work on getting rid of that slump. So what you're going to do, and if you hit your neighbor, just scooch over so you got some room. Bring your left arm up, and we're going to go pinky forward like Daniel's son from Karate Kid, and you're going to bring your elbow slightly above your shoulder, and then you're just going to bring your elbow back. And you should feel a nice stretch right into the front part of your chest. And when you're doing this, make sure you're just looking straight ahead, and you're just going to hold this. And we're going to hold this for about 15 seconds. If you can do this in the door frame, and just make your elbow perfect. When you do this in the door frame, just step into it, and you'll feel a little bit of a deeper stretch, but there's not 8 door frames available right now, so we're just going to do what we can. And then we're going to, yes, sir. So, his question was he didn't understand the door frame part. What the door frame does is it keeps an anchor there so you can get a little bit deeper of a stretch. Yes, sir. You just put this just like this, and then you just step into it, and you'll feel a lot deeper stretch. So every time you go and get a coffee, you go and get a water, go to the bathroom, just do that stretch. You put these in periodically, you'll unslump it. Oh, no. Now we'll do the same thing with the other side. Bring that other arm up for me, please. Elbow slightly above your shoulder. And you two bring those down just a little bit for me, please. Perfect. And then bring that elbow back. And you're going to feel a nice little stretch there. Only go until you feel the stretch, 15 to 30 seconds. Now, if this bothers your shoulders or anything like that, we got something else going on in there that we can look into. And then I'll send Christy some handouts of these as well, or some diagrams so she can email them to you guys so you can do them at your desk. Any questions with this stretch? Okay, the next one we're going to do are the wrists and the hip flexors. And I'm just going to put this down for a second. So when we're working at the desk, we have our hands like this, right? There's a law, it's called Davis law. It has to do with soft tissue. Anytime you train a soft tissue to do something, it's going to want to stay in that position. So if we're training our wrists to be like T-Rexes, they're going to want to stay in the T-Rex position. So what we're going to do is bring your arm up like this. You're going to, with your other hand, you're going to just point your fingers down, and you're just going to hold this. You're going to feel a little stretch right in here. So a lot of the wrist muscles actually come from the elbow. So you're going to feel this probably closer to the elbow than you actually do the wrist. 10, 15 seconds. Ideally do it for about 30 seconds when you're doing this on your own. And then you're going to do the same thing, and you're going to bring your wrist up towards you. You'll feel it in a similar location, but slightly different. And hold with this, try to keep your elbow straight. And then if you really want to go to the next level, bring it up, palm up, and you say, stop. I don't want to be in pain anymore. And then you bring your wrist, same thing. Just like this, just so you should feel that nice little stretch in there. In 15, 30 seconds, then you do the same thing on the other hand. So if you just have this really aggressive email that you have to send, and you just put your heart and soul into it, and you're sweating after sending that, you're like, oh, my wrists are bothering me, this is going to be a good one to do. So down, up, and then you just flick the wrist, like Kobe Bryant. Just a little flick of the wrist. So the next one we're going to do is the hip flexor stretch. What the hip flexor is it's a muscle that does this motion. What are all of us doing right now? We're sitting, and our feet are in a position like this. So if we train the muscle to be flexed forward like that, we're going to want to stay like that, which then causes our spine to start doing this, which then adds more pressure onto the discs. Think about the disc. Anyone ever see one of those things at the lake that's the blob? One side's inflated, the other side's deflated. Someone jumps on it and it gets launched up. You guys know what I'm talking about? Think about the disc like that. If we put a lot of pressure on the front of the spine, the disc material is just going to start oozing out to the back. So this one, I'll have everyone stand up for me, please. And we'll need a little space. Good thing we got some space up here. And if this hurts your back, knees, ankles, I'll show you a different one at the end. Just pull me aside. What you're going to do is just take a little lunge back. Good. And then with that leg that's back, bring that same arm up. And you're going to lean back a little bit, and then you're going to lean over to the side. And you should feel a nice little stretch right in the front of your thigh. If you don't, then just get into a little bit more of a lunge position, bend that back knee, and then lean over. Does everyone feel that little stretch? And then switch your arms for me, please, sir. So left leg back, left arm up, do a little lunge, and then lean over to your right. The other side. Good. And you should feel that right in the front of your pelvis at the top of the thigh. That's where the hip flexor lies. Again, every 45 minutes, get up, walk around, do some of these stretches. And now we'll do the other side. So opposite leg back, do a little lunge, arm up, and then lean over to the side, the leg that's in front. And you should feel a nice little stretch. Now, if you start doing these and you don't feel the stretch as much, the next thing you do is just bend the knee down a little bit more and then lean over into the side. If you feel unstable while doing this, feel free to just grab the back of a chair to support yourself while you're doing this. Any questions with that? Did everyone feel the stretch in that area? Okay, good. So these ones, the hamstrings and the piriformis. The hamstring muscles are right on the back of the thigh, and the piriformis muscle is right in the butt. So this one, I'll have you guys stand up again for me, please. You can do this a couple different ways. How we're going to do it, if you can get a platform, awesome. If not, bring one foot in front of you. Keep that leg straight, and you're just going to come down and just go and try to touch your toe. If you can touch your toe, great. If not, you just go in, again, you just go until you feel a stretch.
Now, if someone didn't have the ability to, like their balance goes off, they could actually do this sitting in a chair.
Exactly. I didn't know where I was going to be presenting, honestly. And then everyone's in business clothes. I didn't want them sitting down. But yes, you can do the same thing. When you're sitting, you can put a block underneath your foot so it's a little elevated and just lean forward and touch it. You'll feel it all the way down from your glute to your calf. Now, you can also just go feet together and just come down and touch your toes or try to. You don't have to if you don't want to. Okay, so we're going to go through those again. Bring that right foot out for me, please. Now put it back in. I'm just kidding. And then, yeah, exactly. Yeah, exactly. Okay, and then you're going to come down. We're going to hold this for about 15 seconds. And make sure that you're right on the heel the best that you can. Only go until you feel a stretch. Good, and then we'll do the other side. Good, very good. So the key to this one is you're going to hinge. You did that excellently, by the way. Hinge at the waist, not just bend over, but when you bring it back, push the butt out when you lean into it, not just dump the shoulders into it. Perfect, perfect. Now everyone, I got to watch everyone do it. You too, Michael. Okay, good, good. And then yours, just push your butt out just a little bit when you, good, excellent. And that's good flexibility. Okay, so the next one is the piriformis stretch. Cool thing about the piriformis is the sciatic nerve travels right underneath it. So if we're sitting all day, and this is one of the butt muscles that we sit on, it can irritate that sciatic nerve, and then we can get some of that pain going down the legs, and it gets really tight, and you get up and you walk around and it goes away. That's not good. So you can sit down for me. And anyone have any hips or knee issues? If you do, I'll show you a different way to do this. If not, then what we're going to do is just take your left foot and cross it over your right knee. Good. And then you're just going to lean towards your left knee. Good. And then try to keep that knee down so it's more horizontal with the ground. So you can push onto it with your elbow, but don't force it. Only go until you feel a stretch. And then you just lean forward, and you just get a nice little stretch right in the butt. Same thing, 10 to 15 seconds. Rest, relax. This one, if you're sitting long periods and you can't get out of a meeting, they might be like, hey, what are you doing in the meeting? You're like, oh, I'm just stretching. Any questions with these stretches in there? So These are all stretches. Stretching helps keep the muscle flexible and viable. Exercise helps strengthen the muscles. So when we are dealing with postures like this and we're all slumped forward, the hip flexors get tight, the hamstrings get tight, the glutes get tight, neck muscles get tight, and our pecs gets tight. So if you can do little exercises, and I'm going to show you this one. I didn't put it in the talk, but this is going to be a good little exercise to strengthen up the muscles in between our shoulder blades to help keep them strong. So you're going to sit up nice and tall. You're going to bring your elbows into 90 degrees right by your side, and you're in this position, not with your hands, but with your elbows. You're going to push them down towards the ground. Then in this position, make sure your ears are nice and tall over your shoulders. Try to just crush a walnut between your shoulder blades. And you're going to, as soon as you feel your muscles in between your shoulder blades engage, just hold that, and you're going to hold this for about 15 seconds. It's like doing a plank, but with your shoulder muscles. Good, good, good. The key to this, keep your elbows as close to your torso as you can. Elbows at 90 degrees, push them down, and then just crush that walnut. Good, 15 seconds. This will be a good one to match up with the pec stretch. Any questions with anything that we went over? Yeah, you can do the cool thing about stretching. You can just do it. If you're sitting for 7 to 10 hours a day, the more you stretch, the better it is. If you're sitting in that position and you're over the computer, you're going to have to stretch out the muscles. So every 45 minutes, get up, walk around a little bit. You don't have to do all these stretches at once, but you can do a couple. If you're like, oh, I feel like I was really hunched over, do the pec stretches. Oh, I was sitting for a really long time. I'm going to do the piriformis stretch and the hip flexor stretch. These are just things that you can do to help keep the posture correct. The better our posture is, the less stress we have on the nervous system. Less stress we have on the nervous system, our immune system's functioning a whole lot better. So what we do at Main Street Wellness is we combine the mechanical and neurological correction, which is with the chiropractic adjustment, and then we do advanced tissue repair with the non-surgical spinal decompression, the class 4 laser therapy, and the extracorporeal shockwave therapy to reverse the damage caused by sitting at desks for long periods of times. When I take x-rays of patients at the office, some of the ones that have the worst backs are the people who sit the most. Truck drivers, admin employees, dental hygienists, dentists, they have horrible spines because they're just sitting at their desk all day. The lower 2 discs in our low back support about 50% of our body weight, but we also have our hips and our knees and our ankles to support a lot of the gravitational force. You take out of the spring of the hip, the knees, the ankles, now all that gravitational force while you're sitting is going right onto your spine, starts adding pressure on there. One drip isn't going to do much, but you keep adding enough drips, eventually that cup's going to overfill, and then that's when we start getting pain. Pain is the alarm system that's saying something's not working right, get it corrected. We don't want to just mask it up with Tylenol, Advil, cortisone shots because it's not doing any correction to what's causing the pain. You're just going to ignore it until it gets so bad that, hey, now I need to go and get surgery and there's really nothing I can do, which is very scary because about 50% of spine surgeries, flip of the coin. You're either best thing I've ever did in my life or I still have the same pain and symptoms that I did prior going into surgery. And then once you get the hardware in there, then all you're really doing is just managing the pain with prescriptions, which is unfortunate. So we try to correct the subluxation, which is that misalignment in the vertebrae that puts pressure on the nerves, reduce the inflammation that's coming from the joint being dysfunctional, reduce the degeneration that's happened from years of wear and tear on the spine and on the joints, and then increase the circulation going into that so we can bring blood, which brings all of our body's healing potential to help the body heal a lot faster. It's like traction on steroids. So yes and no. Traction, it's a very similar device. Traction is traction is just a constant pull, relax, pull, relax, pull, relax. Or spinal decompression, I'm just going to call it decompression. Decompression is a very powerful pull, and then it holds there, then it pulls some more, and then it holds there, and then it pulls some more, and it holds there, and then it oscillates in that constant pulled position. That's when you really get good imbibition or that pumping of the fluids in and out of the disc in there, and that's where you really get good vacuum effect to bring that bulging disc back into the center. There was one study, I forget who did it, but it was done in like 2014, 2015, where they looked at a traction machine versus a spinal decompression machine. They did pre and post MRIs on about 50 individuals with bulging discs in their low back. They found traction was beneficial and restored disc height about 1 millimeter, which we're only supposed to have about 8 to 10 millimeters of disc height in our vertebrae, in our low back. And then the spinal decompression restored disc height about 3 to 4 millimeters, and the disc bulges were a lot less with the group that did spinal decompression versus traction. But in a nutshell, it's just a super powerful traction machine. Just the way it does the traction is a little different. Did that answer your question? Great question, by the way. So our protocol is not just to eliminate your pain, but to increase your focus, your energy, your productivity. People who come in and follow the recommended care find that they're sleeping better. They have more energy, they're sick less often, they're mentally more aware, and they just function a whole lot better than they've ever have before. One of the things that breaks my heart is when people say, oh, I've been dealing with back pain for 10 years. All they do is just give me steroids or painkillers, here's a muscle relaxer. Great, but now it's coming back. And then you just keep going down that cycle, and then now you're at a point where you need to go and get the surgery because the damage is too far gone. So we don't want to wait till that check engine light goes from yellow to a bright red on our dashboard. We want to start correcting the issue as soon as it starts coming about, and then make sure it doesn't come back. So 3 takeaways from today. 1, motion is lotion. On side of our joints, we have this layer of cartilage. It's called hyaline cartilage. Think about who's here used a sponge before. You squeeze it, water comes out, then you unsqueeze it, water goes in. Think about this hyaline cartilage as a sponge for our joints. When we move, it squeezes the nutrients into the joint, and then when we relax, it pushes the waste out. So when you're moving, you're actually helping your joints function better. We're all creatures that have movable parts. If we weren't supposed to move, then we would have straight legs, straight arms, and just be a block. But we are supposed to move. So motion is lotion to the joints. Every 45 minutes, get up, move around. Now, there's going to be times where you can't really do that. You're on an airplane or you're in a meeting that's 2-3 hours long. You can't just get up when the mayor comes in and he's, oh, sorry, Jim, I got to go and walk around a little bit. It's 45 minutes. But the more you do this, the better your body's going to be. You're not going to be able to do it all the time, but more times than not is always going to be beneficial. Does anyone here play an instrument? Does anyone here know somebody that plays an instrument? Yes. And then they practice. If you only play the instrument once a month, you're not going to be that good at it. You play it once a week, you're going to be okay. You do it multiple times a week, you're going to get really good. Just like anything else, the more we do it, the better we're going to get at it. The better we are at it, the better our bodies function. The next one. Alignment is foundation. Our spine is literally the backbone of our health. If our spine isn't in its proper alignment and isn't functioning right, then we're going to have that dimmer switch on the nervous system, extra stress being applied onto other systems in our body, like the endocrine system and the immune system, and then now things aren't working the way you're supposed to. So getting your spine adjusted, checked, moved, make sure things are functional is going to make sure that our body is just working the way it's supposed to. And then healing is active. Like Christy said, health is something that's earned. As much as I want to say we're all healthy until we're sick, unfortunately, that's the allopathic model that we have in our country, is you're fine until you have pain, or you're completely okay until this comes up. There was a study done by the Angiogenesis Society, which is a cancer research facility, that looked at women with ovarian cancer. 99% of these women that went in on this study all reported, I feel great, I feel fine, I feel absolutely amazing. Every single year when they went in to go and see the OB/GYN, I feel fine, I feel great, I feel amazing. 10 years later, they go in, they get their blood work done, and they say, hey, you have stage 3 or stage 4 ovarian cancer. And that's at that point, it's detected in there. So I'm not saying getting adjusted is going to prevent you from having cancer or anything like that. But just because we're not feeling any signs and symptoms doesn't mean our body's functioning right. We don't want to wait until we start hurting to start investing into our health. We want to make sure that we're invested into it. Now, health is multifactorial. We have a physical component, we have a chemical component, and we have an emotional component. Physical component is our framework. What are we doing for exercising? Is our alignment correct in our spine? Is our body working the way it's supposed to? Chemical component is what toxins are we putting into our body? The CDC reports that we consume about 70,000 different toxins every single day from our food and the pollutants that are in the air. That's a lot. That's a lot of toxins. And then we go in. We've all been there, myself included. It's a late night. You were here late at the office getting work done. It's 7 p.m. You're like, I don't really feel like going home and eating dinner or making dinner. And Wendy's is right there, or Burger King's right there. But we do that enough times. Eventually, we have all that inflammation that comes from food, which then causes joint pain and just that sluggish mental fatigue. And then the next part of health is just the emotional component or the mental component. What our mental health is affects our everything else. There's actually a huge correlation between what we eat and how it affects our brain. Anxiety, depression, bipolar, all of that can be influenced by just eating a good whole food diet and not eating garbage food. Garbage in, garbage out. Good stuff in, good stuff out. So your next step, if you're ready to stop just managing the pain, managing the symptoms of your desk job and reverse the damage that has accumulated over the years of working at the desk, then we can schedule you for a comprehensive, focused exam, see what's going on, and see if you're a candidate for what we have at Main Street Wellness and Chiropractic. So here's a QR code to our scheduling link if you want to make an appointment. If not, then I hope you guys learned something today, and I'll open it up to some questions and answers if anyone has any. Cool, you got, yes, sir.
Bi-weekly adjustments, are they effective?
Yes, so I personally get adjusted every other week. That's what I need. Sometimes I do a little bit more and tweak my back or add a little bit more stress on. Like if I went, last winter, I went snowmobiling out in Utah, and I tipped my snowmobile over, and it was in about 4 feet of snow, and I tried to pick it up and bring it out. Felt a little something in my back, so I went in and got adjusted sooner than that. So there's different phases of care, right? Just like there's different phases of if anyone's trying to lose weight, you have a very intense workout regimen, very intense diet regimen that you follow to get to the point that you want to be for your physique. Then after that, it's just easier to maintain it. So there's corrective care, and then there's maintenance care. Then there's also patchwork. Patchwork is more of, hey, if you want to just come in and just deal with the symptoms now and wait till they come back in again, we're just patching it up. It's like bringing your car into the mechanic. They say this whole thing's rusted out. We can just solder a piece of iron onto this, and it will help out for the time being, but the issue will probably come back. So at our practice, we try to work on correcting the issue and then maintaining it. Maintenance is a lot easier to keep up with than the corrective care, but the corrective care is what gets you to the point of maintenance. So to answer your question, yes, bi-weekly adjustments or every other week is beneficial. There's a good researcher out there. Her name's Dr. Heidi Havoc. She's a chiropractor who then did a PhD study in neuroscience just to see how the adjustment influences the brain. And she recommends that people get adjusted every single week. I'm finding it's okay with every other week, but that's what the literature says. Then there's also the, can you fit it in your schedule, and can you afford it, and type things like that. So I found that every other week is a good balance between what people are able to do and what I would recommend for the care. Did that answer your question, sir?
It did. I was just curious if bi-weekly was still effective. What's that little springy thing device?
So the activator. So we have people, his question was, what's the springy thing? It's an instrument that we use to help with the adjustment. In there's our people that have very severe osteoarthritis in their spine, osteopenia, osteoporosis, where their bones just aren't as dense as they used to. As much as I want to give them a manual adjustment, because that's what I spend a lot of money to learn how to go and do, it's not going to, the risk is too much versus the reward. So we have an instrument-assisted adjustment called the activator or the Impulse IQ, 2 separate ones, and it sends an impulse into the tissue. What the adjustment really does in a nutshell is it takes pressure off the nerve, but when you put motion into that vertebrae, it creates this huge response inside the prefrontal cortex of your brain, which then just starts to reshape your brain so it's better at processing information, and so your body's better at adapting to stresses in there. There's literature out there that shows whether you do the instrument adjustment or whether you get the type of noise with the manual adjustment, it gets the same results at the end. But the adjustment is the adjustment. When we have chronic pain because a lot of degeneration in the spine, that's when we'll do other things like non-surgical spinal decompression, shockwave, class 4 laser therapy to help heal the tissue around the spine as well. Of course. Is there any other questions? Yes, sir.
Your thoughts on mid to high arch and chew inserts?
So there's a lot of research out there that it's one side says you need to have arches in your feet. Another side says you just need to get your feet mobilized and remold them. It just depends on the podiatrist. I've had people come in before that they're from other parts of the country. They're like, my chiropractor did custom inserts, and since then my back pain has gone away. I've had other people that come in that says, I just spent $1,500 on these custom inserts, wore them for about 6 months, and made no difference on my low back pain. So everyone's a little bit different. I don't do too much custom orthotics because the research is very ambiguous about how it's effective, and I don't like doing anything unless there's an abundance of research that supports this treatment is effective for X, Y, or Z. Did that answer your question?
Sure. Yep. Thank you.
Of course. Is there any other questions? Okay, excellent. Well, thank you all for your time today. Hope you guys learned something, especially feel free to take a picture of this slide because this is going to be the 3 key takeaways. Motion is lotion, alignment is foundation, and healing is active. When we're sitting around not doing anything, our body's not moving. When we're not moving, we're not pumping blood, and when we're not pumping blood, we're not getting circulation through, which means we're not healing the way we're supposed to. So motion is lotion, that's the big one. Well, thank you all very much for your time today.
Thank you, Dr. Noah, for coming today and being here with us and presenting on such an important topic. And I think musculoskeletal is real here. We have a lot of staff that have issues in that realm. So it was very helpful to see that you had brought that up and that what that ties into when it comes to the body and how our bodies function. I think you also said, too, the investment in yourself is important now because if not, you're going to pay later in your health. Absolutely. And I think that's super important, and it's something that people, especially nowadays with just the world being as expensive as it is, it's important to know that you can still find things to do for your body to help, like those stretches. You know, if right now you can't afford chiropractic care, you can at least be doing stretches and doing things like exercising to strengthen your body. So again, you're able to get back to that when you can resume, that level of care. But definitely, thank you so much for hitting some of those high points.
Absolutely. And sorry, to go off of what you just said, there was a study done in 2019 that when someone has musculoskeletal spine pain, neck, mid-shoulders, low back pain, and they utilize chiropractic care first before anything else, they end up spending less. They spend $20,000 to $30,000 less throughout their course of their lifetime on treatments when they utilize chiropractic care first versus going any other route. And our office policy is we never let finances get in the way of the care you need. One way or another, we'll make sure it works so it doesn't stress your wallet, but you also get the care that you need so you're not having a diminished quality of life.
Great, thank you. So I want to thank everyone for coming today, for being patient with the late start. Next month, we'll be here again. Next month, the topic is on diabetes awareness. So we're going to have our nutritionist, Jacqueline Fodor, who's going to be in here. She's going to talk about carbs and how carbs affect the body. She is a great presenter, very energetic, very knowledgeable, so I encourage, if you're interested, to watch for that flyer and the announcement and join us on that. Thank the TV station for recording us today. I think that's great. Thank you for getting us up and moving. That always makes a presentation a little bit a little more exciting for us. But thank you so much for this information.
Thank you all for having me today.